Cervical cancer, caused primarily by the human papillomavirus, remains the leading cancer among women in Ghana. The World Health Organization estimates that in 2022, about 660,000 new cases of cervical cancer were recorded worldwide, with 350 deaths. In Ghana, nearly 3,038 women are diagnosed annually, and more than 2,000 lose their lives, making it the most common cancer among women aged 15 to 44. Health experts say cervical cancer is preventable and curable if detected early and treated promptly. To tackle the disease, the Ghana Health Service, in partnership with stakeholders, is rolling out a nationwide HPV vaccination campaign targeting 2.5 million girls between the ages of 9 and 14. The campaign begins on September 5, and the vaccines will be provided at no cost as part of Ghana's routine immunization program. Dr. Nazir Tanko Mohammed, Deputy Program Manager of the Expanded Program on Immunization, said Ghana first piloted the HPV vaccine in 2013 in the Greater Accra, Central and Northern regions. After 12 years of successful implementation and monitoring, he said the country is ready for nationwide rollouts to protect the next generation of women.
Cervical cancer is again one of the conditions that is very worrying, because in Ghana alone, for instance, every year we are recording about 2,500 cases of our mothers, sisters, aunties going down with the disease, and mortality, deaths among those who are actually affected, almost half. So out of the 2,005 thereabout, almost 1,005 of them every year, again we lose them. And it's a similar even picture globally. Globally, about 600,000 cases every year. And out of that, we are losing almost 300,000 of them. Just that, unfortunately, most of them are occurring within our settings, low, middle-income countries. So Ghana not being an exception. And as a country, we have aimed or dreamt of actually introducing a vaccine that can really protect our mothers later in life against this cancer for a long period. But because of some challenges, especially in terms of the resources, we had to actually even start by way of piloting in smaller numbers in some districts, in Greater Accra, Central region, Northern region. And out of the lessons that we've actually picked from the 2013, as I speak now, plans are far advanced to introduce the vaccine in our routine immunization program for free for young girls 9 to 14 years. So tentatively, we are looking at somewhere the last week, thereabout in September, if all things go on as planned, where we will start with a campaign, a vaccination campaign, targeting all the young girls 9 to 14 years to give them a dose of the Human Papillomavirus vaccine, which is aimed at protecting them against the cervical cancer later in life. And when this is done, it will be able to actually reduce the numbers of the cancer-related illnesses and deaths that we've been recording in country.
Executive Director of Hope for Future Generations, Mrs. Cecilia Senu, described the initiative as a major step towards safeguarding the health and future of Ghanaian girls, urging collective support from parents, schools, and communities.
For us, that has always been our advocacy, to protect our children, our girls, our daughters from getting cervical cancer, because it is cheaper to prevent it than waiting for the children to get it, because we have the human papillomavirus all over the place. The moment the child starts having sexual intercourse, she'll be exposed to that, and that will automatically mostly develop into cervical cancer if it's not detected early. And the resources or the money you have to spend to treat cervical cancer, the psychological trauma, the family problems, the stigma is too huge for the mother or the girl child. Now you see many young people even developing it. And so it's important, and we are happy that the government will be rolling it out. What we encourage the government is to ensure sustainability and put in more resources that our young girls are protected in this country so that we can eliminate cervical cancer completely from the country, from Ghana.
Some parents have already expressed their willingness to have their children vaccinated, describing the exercise as a vital protection against cervical cancer.
Because ena nkora no so a bebre ntumi nhwe nkora no ye wo niam bi omudi mu omoduane di niam mu de ese yenya different yenya edro important ye manom especially yesi nkora ma mi se de mi wo baba baako pe nanso de bia na mi pese mi boni ho ban emfri niam bebre so nti se mudi bibi se e badia ebeye de say enye scarce because ebia na wakose ska bebre awo sa wo ba no wo yare na wo kan na so ebia won so mbe ya boaye free nti enu su ye.
The Ghana Health Service has assured the public of the vaccine safety and effectiveness, emphasizing that its successful uptake will significantly reduce cervical cancer cases in the country.